Today, the FDA's vaccine advisory panel is scheduled to consider Moderna and Pfizer's COVID vaccine for young kids. And this comes after the panel voted to give the green light to Moderna shot for children ages 6 to 17. So here with more on all of this is founder of Gramercy Pediatrics, Dr. Dyan Hes. Dr. Dyan Hes, it's always good to see you. I'm glad you are here. So let's talk about this. It looks like, you know, the youngest of us will be able to get vaccinated. But, you know, I'm looking at some of the statistics, right? Only around 30% of children ages 5 to 11 are actually already vaccinated. So is there a desire and interest to have even younger kids vaccinated? What are you seeing in your practice?
Yes, I am definitely seeing, because they've been so limited in what they can do, especially in New York City. But in places that have mandates where kids can't enter if they're not vaccinated, or if you have a sibling who's already vaccinated but you're not vaccinated and you can't go in, travel, people want, it's the summer, people want to get on an airplane with their kids.
Yes.
I feel the desperation in the air, actually.
That's really interesting. You know what I'm going to get you to do is sort of flip your hair back just a little bit because it's rubbing on the microphone. Perfect. I don't want anyone to miss anything. For parents looking to get their kids vaccinated, what are the pros and cons of getting one vaccine over another? Because, you know, we've seen this delay with the Moderna being approved.
Well, you know, the truth is going to come out in a few months from now. Like, everybody ran to get Pfizer, and then we saw Moderna was more effective in less, you know, breakthrough cases, although it's not really breakthrough.
Yeah.
So as a pediatrician, I tend to like Moderna because it's 2 shots. It's 2 shots separated by 28 days. It's hard enough to get a person to come back for a second vaccine, let alone a third vaccine. So Pfizer is going to be 1 shot, then 3 weeks, and then 8 weeks from the second shot. So that's over the summer, we're going to have to corral everybody back 3 times.
Yes. Yeah. And goodness knows that it's tough to do, especially in the summertime when people are going away and all that sort of stuff. So some of the COVID-related stuff in the news, though. It's a new study out of Israel, I believe, linking COVID to pediatric hepatitis.
So this is a very loose association.
Okay.
So right now in the United States, actually, we don't believe that there's any increased hepatitis in children. So it seems to be in the rest of the world, but we haven't seen an increase in severe hepatitis in the United States.
That's interesting.
And previously, up until now, we thought that it was associated, about 2/3 of these children tested positive for adenovirus, which is one of the common causes of the common cold. But think about it. If about 80% of children have already had COVID, and then they might get another virus, maybe it's a double whammy. Maybe it's that you were already susceptible after you had COVID, then you got adenovirus, then you got hepatitis. It's also, the numbers are so small, we're going to have to tease this out. So it could be, you know, the Israelis are always a step ahead of us when it comes to COVID research, so they might be onto something, and we'll just have to wait and see.
But I think it's a really good reminder because, you know, here we sort of get this, this data, this information, and we kind of try to give it to the audience in a bite-sized form. And one of the things that we have been saying is, you know, here are the number of cases worldwide, here are the number of cases that don't seem to have causes in the U.S. And it's sort of suggested that there may be a connection, but you're saying actually there haven't been an increase here.
In the United States, there's not an increased number of hepatitis cases. But you have to also remember that so many people on the planet already had COVID now.
Yes.
So is it that they had COVID and then they got adenovirus, that they never even knew they had COVID and they got adenovirus? So this is going to have to be teased out. Yeah.
And I know obviously you don't know sort of about how things are approved and all that kind of, but if we do see an approval for this vaccine for 6 months, how quickly do you think you'll be getting it into your office based on what you've seen with the previous age groups?
The minute it gets approved, New York City will release it. So we are on like a pre-order and we keep on waiting. And so we've been really lucky that as soon as your order, I think the hardest part is placing the order. There's a lot of logistics for physicians.
Right. Has that gotten any easier? Because I remember earlier in the pandemic, it's one thing you know, talked about.
It's hard. You have to order a large quantity. And just remember, like for me, yesterday I had Pfizer booster clinic. And you have 10 doses. You have 6 hours to give those 10 doses. 5 patients canceled yesterday. So then 5 doses are going to go in the garbage.
Wow.
So then we start calling people who we have booked for next week. Can you please come in? Can you please come in?
Right.
So there's been a lot of waste of COVID vaccines. So I hope that with the newer vaccines, they'll have this longer window that we can store it longer, that we don't have to throw it out after 6 hours. And I'm not actually sure of the new Moderna, what the storage is going to be. Maybe it'll be a little bit better and we'll have more leeway to get more kids in and do it and be more flexible.
For goodness sake, keep your appointments.
There's a lot of logistics that people don't know about. Yeah.
Dr. Dyan Hes, thank you very much.